Assalamualaikum warahmatullahi wabarakatuh. So I'm Nurul Haziqah. So today my group we present about the healthcare sector in Malaysia, which is the hospital Sungai Buloh. So what is the backgrounds of the healthcare in Malaysia? There is three stages, which is before independence, after independence, and right now. So before independence, before the Malaysian was gains independent, the healthcare sector is more to the traditional method. It happened during the colonization as it brought the knowledge of the Western's medical practice, and day by day they are the constructions of the hospital, where during at that time hospital establishment was to treat workers in the mining industry. So after Malaysians received independence in the 1957, the healthcare Malaysia, such as a hospital, was made an improvement when it's already have 65 hospital. And at the same time, based on the statistic in 2017, it showed that the numbers of the government hospital is around 144 and 240 was the private hospital. This is where the operations of two-tier operations happen in the healthcare industry. And what can be seen from that, during 20 years of independent, the developments of the healthcare has been paid attention, and the country was always focusing on upgrading the healthcare service, which at the end, Malaysian's country was success to build health center, small health center, and also the clinic. And right now, we also can be seen that governments of the Malaysia was always paid attention to the healthcare sector, which is we can see there is a lot of program made by the governments in order to ensure the healthcare sector was always make an improvement, such as the most program that was being got a good acceptance by the public was the One Malaysian's Clinic, which is this program was established by our previous Prime Minister, which is Datuk Seri Najib Tun Razak. And at the same time, in 2019, Malaysia was ranked numbers 1 in the healthcare category of the International Living Annual Global Retirement Index 2019 with a score of 95 out of 100. So this can be seen that healthcare sector in Malaysia was always make an improvement, and the Malaysian country always focusing on the healthcare sector.
Hi, Assalamualaikum Madam. My name is Afiqah Binti Rouse, and now I will explain about the current emerging issue in the healthcare sector in Malaysia. So the first issue is our healthcare sector nowadays was in effort to fight with the COVID-19 virus. This happened when on 4 February 2020, the first case of COVID-19 has been reported by the Ministry of Health. This situation has made Hospital Sungai Buloh be a center to treat this disease. This is due to the expertise that they have in controlling contagious disease. This situation was not affect Hospital Sungai Buloh, but also all of the government and private hospital as well. Besides that, this situation have given challenges to the healthcare sector, where they experience a shortage of masks, face shields, and also personal protective equipment (PPE). Even though there are many help sent by the non-government organization, like Afin Life Insurance has donated 15,000 PPE to the healthcare workers, but this situation was not solved because the endless of the COVID-19 virus. Secondly, the current issue is the low number of blood in the bank. According to the Head Director of Health, Dato' Abdullah said that during the implementation of Movement Control Order (MCO), the number of blood donation was only 16%, while during the Conditional Movement Control Order (CMCO), the number of donation has dropped to 57%. This situation has made the healthcare sector be in a difficult situation. This is because the sufficient number of blood in the bank was important because it will be used for the emergency situation like accident when a pregnancy woman is bleeding and for the cancer patient. So as to encourage people to do the donation, the government has asked the healthcare sector worker to take the donation at the donor home. This situation still not gain a donor confident because they was not sure either they has been exposed to the virus or not, even though the government had said that the COVID-19 virus COVID-19 test will be done before the donation. Lastly, the current emerging issue in the healthcare sector in Malaysia was a shortage of employees. According to a study being made in India, it was found that 52.8% of their healthcare workers was experienced burnout due to the spreading of COVID-19. This situation was not only happening in India but also in Malaysia. So in Malaysia, we have 141 government hospitals, 2,860 government clinics and also 6,800 private clinics. The overcrowding of clinics and hospitals in Malaysia has meant there is insufficient number of employees. So in order to solve this problem, according to the pandemic, the government has asked the retired nurses and doctors to work back, where they will be paid in a daily basis. Not only that, the financial constraint also has made the medical institution unable to make a new intake of students, where this situation will give a long-term effect to them, where in future they need to import students from the other institution to work with them, which only require more spending.
Hi, my name is Martina, Anak Banyi, and I will explain about the role of public relations in the healthcare. The first role of PR in the healthcare industry is spreading the health information. They need to spread the health information to their target audience, such as the patients. It means they need to know who their target audience for the messages to be delivered so that the purpose of the messages is achieved. The first role is one of the most important roles that portrayed by the PR in the healthcare industry. PR in this field will spread or communicate the health information in the form that could be easily understood by the society. It is because not all know the medical terms, which require those who are having a medical background to translate it into the easiest and simple words for the public to understand. For example, during this COVID-19 outbreak, the PR in the healthcare industry must be played their important role to spread awareness regarding this virus. They need to educate the public about what can be done to prevent themselves from being infected with this virus. According to Hilmi and Emmanuel in 2014, as the PR need to communicate to the public, creating and sustaining their relationship between the hospitals, internal and external audiences is also part of their responsibilities under this role. As they are delivering messages of the health information to the public, they require skills in communicating. This is because with an excellent communicating skills owned by the PR, will ensure them to obtain the public support, trust, goodwill and confidence. Thus, they also are able to persuade the public to change from an unhealthy lifestyle to healthy lifestyle, such as stop smoking, driving while under drugs and alcohol influences, or the young children immunizations. Secondly, the role of PR in the healthcare industry is building corporate image. This role is referring to how the PR under the healthcare industry protecting and creating a corporate image so the healthcare organization is favorable to the public. This can be done through customers or patient satisfaction. Customer satisfaction is important for the PR to build a good image for the healthcare industry. According to Berkowitz and Flexner in 1981 research, the efficiency of health services, including cleanliness of physical facilities, hospital staff's attitude and behaviors, and the hospital's credibility and good image of the hospital can influence the customer's satisfaction towards the hospital. That is why the function of PR under this industry must be played properly to reach the customer satisfaction on the hospital services. They need to grab the attention of the public by revealing the benefits that exist in the hospital to the public. As mentioned by Walensky and Kurtz 1984, the example of benefits offered by some hospitals is low cost for treatment, also one of the factors that influence customer satisfaction. Kidar in his research When customers are satisfied with the hospital services, they will recommend it to others, and such recommendations are more effective to influence the others than the advertisement. It is important for the PR in hospitals to be concerned with the customers' feedback on the hospital services so they can disseminate it to the parties inside the hospitals and also disseminate about the hospital's capability or reputation to the public. When there are negative rumors about the hospital, they need to entertain it by clarifying it. It is because it helps to protect the organization image. This is according to what Peter in 2007 in his research has mentioned. Finally, the role of PR in the healthcare industry is adapting to the changes in the environment. It is because when PR can adapt to the changes, it will ensure their works to deliver messages or information to the public can continuously be done without any interference. According to Sasser, society today is increasingly moving away from traditional mass media outlets such as newspaper and television to digital media, which is more personalized and interactive means of communication such as internet, Facebook, and Twitter. For example, in Malaysia today, we can see there are many private or government hospitals are having their own social media and website. From those digital platforms, the public can see their organization's information and even directly get number or email for them to contact for further questions. During this COVID-19 outbreak, most of the spreading information cannot be done physically or in the traditional way since we need to reduce the physical contact, which also can reduce the risk to be infected. So, PR of this industry can move to the digital platform to disseminate the information. This is more convenient and safer for everyone since it does not involve personal contact and all they need is connection of the internet to get the information. Even in this chaos environment, the PR still can engage and connect with the customers on the internet. Okay, that is all from me. Thank you.
Hi, my name is Jenny Anak Lusat. Today I will present the challenges that faced by the public relation officer. Firstly, the challenges that faced by public relation officer in healthcare sector is on the media challenges in controlling any kinds of bad issue. As social media is the basis of the for the public relation during digital age, everyone is managed to receive any kinds of information in the split of second, which give benefit for the public relation officer itself to communicate the information towards the public. However, the benefit that given also could give challenges for the public relations to deliver their responsibility, especially in healthcare sector, in order to control it from any kinds of bad issues. Since healthcare sector also can be manipulated by irresponsible people from any kinds of situations or unconditional environment, such as novel coronavirus or known as a COVID-19 that has affected the whole world. This is because anyone can publish their dissatisfactions toward the organization, or sometimes the irresponsible people also can make manipulated certain statement that has been made by public relation, especially in healthcare sector, which could give effect for the organization name as well. That is why the public relation officer should put a lot of effort on it, and it become more competent in order to save the image of the organization, since social media is hard to control once it's spread by the irresponsible people. Secondly, the challenges that faced by the public relation officer is poor manpower. This is because the relevancy of the public relation officer job nowadays is cannot sustain as much as other job that has become the most choices. This can be seen that people are not interested, and it is affect the list of the knowledge about the existence of the public relation officer and the role of them. This make the choices of this job become list that causing into poor manpower. when the organization having poor manpower, so the functions of the public relation itself will be slow and they unable to reach the target audience in order to communicate, which there is no effectiveness in communication of the information to the people. The role of the public relation is least known by the people nowadays, especially those who are fresh graduate. That is why the public relation is not be included in the most job demands in the world rather than other jobs such as medicine, engineering, and etc., in which make the functions of the public relation cannot be seen, and their effectiveness also not as powerful as their vision and mission that created. This is due to the poor manpower in that sector. So this make organization unable to find out the expertise in this field until make them unable to deliver communication well to the people. Thus, every of organization should take part in order to make the problem of the poor manpower could be eliminated in the public relation officer. Thank you.
Next is about the roles and the functions of the public relation in Hospital Sungai Buloh. There is 6 functions and the roles. The first is public relations need to see any complaint. Means that the public relations practitioner must monitor and take any actions on any complaint makes by the Public Complaint Bureau, Kementerian Kesihatan Malaysia, hospital website, and also the recommendations board. This is to ensure that the hospital always alert and known about what makes the people dissatisfied with their service, which can make every change that they make are necessary. Second functions and the roles of the public relation in Hospital Sungai Buloh is to monitor the mass media. Means that they need to monitor any issue that published through the mass media and coordinate the feedback from the press media report. This is because to ensure that the mass media does not giving unnecessary informations to the public. And the third function is the publicity. Publicity means PR need to plan and coordinate the activity and publicize of the department through the mass media, including the press conference, media release, and the media coverage. Means that it need to coordinate the recording and the broadcast as well as interview session. And then PR also have the functions and the role to make adjustments of the facility. Means that PR will coordinate the applications of the media and individu that wanted to do the media coverage, news, article writing, and it also related to any media and individu who wanted for the visit or to do any filming. So because of that, PR practitioners must take many consideration before giving any permissions to them in order to ensure that the activities in the hospital does not be affected by the media coverage or any individual that wanted to do any filming. So this function is really important, especially we can see last year when the government said that the hospital Sungai Buloh was being announced to be a full COVID-19 treatment center, from hybrid COVID-19 hospital to fully COVID-19 hospital. So these functions and the roles of PR to make coordinate and applications of the media individual that who wanted to do a filming must deal with the PR first before they can do a filming. And then the next is the monitoring public notice. Means that the public relation must always keep updated the informations in every corners of the hospital in order to ensure that the people or the public know the new informations about the hospital. And the last one is about the publication. PR publications mean the public relations or the PR will assist in the productions and the publications of the department's annual report and other department publications.
Jawatankuasa Siasatan Bebas telah memanggil 17 individu berhubung kes gangguan seksual ke atas doktor pelatih oleh seorang ketua jabatan di sebuah hospital di Lembah Kelang.
Polis memberi amaran kepada orang ramai supaya tidak membuat spekulasi dan berita palsu mengenai keadaan politik negara semasa. Ketua Polis Negara Tan Sri Abdul Hamid Bado berkata, pihaknya akan mengambil tindakan terhadap individu yang didapati sengaja menimbulkan kekecohan dan menggugat ketenteraman awam.
Yusuf Asu coming soon. Nah, seperti yang saya katakan, stop. Jangan buat benda-benda yang menakutkan orang. Ramai sangat doktor pakar di kalangan masyarakat ni. Ya? Doktor pakar yang separuh masak, yang mengeluarkan dia punya dia punya pendapat-pendapat dia pick up daripada tempat lain yang tak tahu asal usul dia. Ya? Lepas tu disebarkan, lepas tu siap memberikan pandangan, nasihat kepada orang ramai, menakutkan orang. Kita mesti yakinlah kepada yang dikeluarkan, kenyataan yang dikeluarkan oleh Kementerian Kesihatan. Yakinlah.
Okay, next, the examples of issue and how they overcome their situation. Okay, issue 1 is facing with fake news in social media. In 2017, Hospital Sungai Buloh also faced with this type of fake news issues. The fake news was spread through the social media platform, which is a woman asked a fund up to 25,000 ringgit for the cost of operation for her boyfriend. Okay, the post that went viral and got almost 1,000 share was too vague and doubtful by the public, as Hospital Sungai Buloh is a public hospital and not a private hospital that will cost that high for the operation. Okay, the public relation departments of the hospital had reacted and take an action to restore the image of the hospital by release a written feedback on the issue. According to Hospital Sungai Buloh, the organisation strongly denied on the statement made and want the accusations to stop being spread. This is because the hospital had explained that all the charge and cost of medical treatment in a public hospital are following the Government Fee Act. What can be seen from the case, the public relation departments of Hospital Sungai Buloh had done their important role in managing the issue and conflict in early stage. This is because when the conflict been done in early stage, it will help in less damage to the organisation. As stated in official website of Hospital Sungai Buloh, the public relation departments are responsible in publicity, media, and the departments seem responsible and accountable with the position as they can manage the issue properly. Then, according to the feedback made for the fake news, the public relation department had used one of 5 general strategies for image restoration, which is denial. Okay, the feedback simply stated the denial on the fake news and also provided with strong evidence. The 5 general strategies were actually introduced by the Professor William Benoit to help the organisation on how to respond when facing a crisis. With the aim to influence and aware the information to the public, the hospital had done their best to communicate and spread the response using the media, social and internet as a platform. Second is the issue of sexual harassment. Sexual harassment is one of the crimes that are very serious, and without any immediate action, it could badly damage the image of an organisation. This serious issue was also once happened to Hospital Sungai Buloh. According to Malaysia Kini 2018, it was stated that the former head of department in one of the public hospital in Klang had been charged for sexual harassment towards trainee doctor. It was also stated that there were many other victims was actually found after more interviews was done. The suspect had used his positions and power to attack the young medical officer. The issue started to related with Hospital Sungai Buloh was when it was found out that starting the suspect work in Hospital Sungai Buloh, the suspect already done his unethical behaviour towards 38 of the employees at Hospital Sungai Buloh. The public relation departments of Hospital Sungai Buloh was playing their roles in this issue, as the press conference of the issue was held at Hospital Sungai Buloh, which is the current workplace of the suspect. Okay, the public relation department of the hospital settling the issue by accepting the complaint of the issue. Okay, based on the issue, public relation of the hospital received and aware on the complaint made and truthfully communicate to the public on the conflict. Okay, the public relation had used a press conference and cooperate with Ministry of Health as a platform to give information on the conflict. If choosing this type of media, it is important to highlight on general principle for what to be said to the media. From the issue, it was seen that it was done in proper ways, as all the information stated was stay with the facts and no accusation made. Hospital Sungai Buloh also seemed to implement one of the general principles as the department keep on calm and cooperative in provide information on the complaint of 38 victims. Even so, these types of critical issue will damage the image of the hospital and will make pupils or public afraid to receive treatment at the hospital. However, with image restoration strategies implemented, which is by corrective action, had slowly restored the image of the hospital. This is because by truthfully and not cover on the crime made by the officer seem to be a good action and create the trust of the public back towards the hospital.
As a conclusion, healthcare was one of the sector in Malaysia that has successfully shown an improvement from time to time. Thus, healthcare in every world, not only in Malaysia, was played the important parts in the country. This is because we can see, especially right now, when the world facing with the COVID-19 pandemic, healthcare sector was played, especially hospital, will really play the important role. Therefore, in order to ensure the process in the healthcare organization always in the good way, then public relations was one of the department that must play their role effectively. So there is a loss of effectiveness, the functions, of the PR in the organization. When by having the PR in the organization, it helped the organization to run the activities smoothly, and also by having the PR practitioners in the healthcare sector that can deal to communicate with the internal and external issue and activities like the public, mass media, and so on. Thus, healthcare sector must have the PR practitioners to control, to handle, and to give information to the people. And at the same time, PR is not only for the healthcare sector, but every organization must have the PR practitioners in order to make sure that the organization always in a good way to run.